Thank you very much for this opportunity. I'll be presenting a bit of my experience with studying mortality among Irish travelers, which is a population-based study. So I'm sure a lot here know about Irish travelers, but for those who don't, Irish travelers are a minority in Ireland, representing about 1% of the population in Ireland. And if you look at the population pyramids comparing the general population to Irish travelers, you'll see that their population pyramid resembles that of a developing country, while that of the general population fits the features of a developed country. And more than 20 years ago, they were found to have much higher mortality than the general population, and the current policy development required more recent estimates of the health needs of Irish travellers. So the All-Ireland Traveller Health Study was conducted, funded by the Department of Health and Children in the Republic of Ireland, the HSE, and in Northern Ireland. Part of that was a mortality study aiming to assess recent mortality of Irish travellers and compare it with the general population. So we went about collecting the mortality data retrospectively. We had two main sources of data. There was a census of Irish travellers, so we asked census respondents to identify deaths in their families, immediate and extended families, over the 12 months preceding the survey, the census. We also asked public health nurses working with travellers to also provide us similar information. We got a crude set of mortality data, which we cleaned by removing duplicates and ineligible deaths that occurred outside our time frame. We ended up with a cleaner set, which we matched with the General Registrar's Office death records. That matching process also allowed us to identify further duplicates, and we also found further unreported deaths that had features unique for travelers but were not reported from either data source that we started with. And we confirmed those, we got those and confirmed them with the traveler organizations. And we ended up with a total of 188 traveler deaths over a 12 months period. 104 of those were both reported to us and identified by their death records at the General Registrar's Office. 62 were reported but not identified, not matched, and 22 were found at the General Registrar's Office but were not reported. So we further linked those that were matched, those that had death records, because they have unique identifiers that link them to the Central Statistics Office database for the coded cause of death, coded to the International Classification of Disease version 10, for comparison with the general population. For the analysis, we took the matched deaths or the linked deaths, and we scaled them up to 188 deaths because we didn't have all the causes of death for the 188 deaths. And we got an observed number. We then calculated an expected number, which is what we would expect if the Irish travellers experienced general population mortality. And then we compared the observed and expected numbers. Observed multiplied by 100 divided by expected gave us the standardized mortality ratio with confidence intervals. And the observed deaths minus expected deaths gave us the standardized mortality difference, or better known as the excess deaths. We had broad, we grouped the cause of death into broad categories, obviously because of the small numbers. And we revised the names just for them to be accessible for the travelers and the public. So we had cancer, heart disease and stroke, respiratory disease, external causes, and all other causes grouped together. Among males, the commonest cause of death was external causes, and it also accounted for most excess deaths. Although the widest inequality when compared to the general population was in respiratory disease, and these are the figures highlighted in red. Among females, the commonest cause of death was heart disease and stroke, which also accounted for most excess deaths, and again, they had the widest inequalities in respiratory disease. So in conclusion, obviously urgent prevention efforts are required, and efforts to reduce mortality among travelers and address these inequalities. And these prevention efforts should consider the patterns observed here, the inequality patterns and the cause of death patterns. Usual inequalities result from complex pathways, so it's not that direct. It's not the direct effect of behavioral lifestyle factors. It's complex pathways that involve the direct and indirect effects of all health determinants, ranging from upstream factors, socioeconomic status, living conditions, environment, employment, education, to proximal behavioral factors such as smoking. And therefore, holistic and intersectoral approaches are needed to address these inequalities. First, I'd like to acknowledge all the Irish travellers for participating in the study. Public health nurses, the Central Statistics Office, General Registrar Office, and obviously the funders, Departments of Health in Ireland and Northern Ireland. And just to clarify that the views expressed are the author's own and do not reflect those of either departments.